Currently, there are 556 people in hospital, including 102 admitted to the ICU. The steady decline we're seeing is encouraging and a testament to the ongoing hard work of so many. Sadly, I must announce that 10 new deaths were reported to Alberta Health in the last 24 hours. My sympathies go out to all who have lost loved ones recently, whether to COVID-19 or any other cause. As of today, there are 51 total cases of the variant, both the variant first identified in the UK and the variant first identified in South Africa. And we will be posting numbers twice a week, so new numbers will be updated on the website tomorrow. We have continued the investigation in the case that I've spoken about before that had no connection to travel. At this point, we still have not identified a source. But at this point, we also have not seen any further spread outside of that household. With respect to the variant, we currently, as I mentioned, have 51 cases. Of those, there are 6 cases in 3 different unrelated households where we don't at this time have a clear link to travel. And of course that is concerning, as it seems that in those cases there may have been a source that we haven't identified, indicating that there likely is some spread in the community that we have not yet tracked back. All the rest have a link to travel, either that individual traveled or is a household contact of someone who traveled. And part of the reason for the increase over the weekend is that there was a batch of travel-related positive tests from over the last month that hadn't yet been sequenced. And so that sequencing was completed over the weekend. And so to be clear, it's not that there were 14 new cases that were just diagnosed. Some of these are historical. And so now we're going back to make sure that we're following up and ensuring that, again, with each of those cases, there was no onward spread. But it is not an escalating number from the perspective of local transmission. While our cases and hospitalizations are trending down, we still have work to do. We have reached a place where we should be able to further ease measures on February 8th, but we have seen cases fall and rise before. We all must remain vigilant and be extra careful to help keep schools, continuing care facilities, and all other settings safe, and to keep our hospitalizations trending downwards. We all must keep doing our part to protect ourselves, our loved ones, and our community at large.